Hi, I'm Jerry Vinci, founder and CEO of CCR Growth. Today, we're addressing a pressing issue with potentially grave consequences: the potential overturning of Medicaid services and its impact on the senior population in the USA. First, immediate impacts: loss of coverage. Millions of seniors depend on Medicaid for essential healthcare services, from long-term care to prescription drugs. Removing these services would strip many of the most vulnerable among us of necessary affordable care. This is particularly harsh for those with limited incomes or pre-existing conditions. Next, increased healthcare costs. Without Medicaid, seniors would face higher out-of-pocket expenses, often having to choose between vital medical treatments and basic needs like food or housing. This not only threatens their health, but also their dignity. This also puts a big strain on families. With the loss of Medicaid, families would often need to step in as a primary caregiver. This responsibility can create immense financial and emotional burdens, pushing some family members out of the workforce to provide necessary care. There's also the overburdened healthcare system. An influx of uninsured or underinsured seniors would likely strain hospitals and healthcare providers, leading to longer wait times and reduced quality of care affecting everyone. Long-term consequences: first, decline in senior health. Lack of preventative care and management of chronic conditions would likely lead to worsening health outcomes for seniors, including higher rates of hospitalizations, disability, and even mortality. Next, rise in poverty. The financial burden of increased healthcare costs could drive many seniors into poverty, exacerbating economic inequalities and potentially increasing homelessness among older adults. Next, we would see an increased demand for charitable care. Charities and nonprofit organizations would face overwhelming demands, possibly exceeding their capacity to help those in need. So what can be done? First and foremost, advocacy. It's crucial to speak out against these changes. Contact your elected officials, express your concerns, and demand they take action to protect senior health care. Supporting organizations that fight for seniors' rights is also vital. Second, community support. Engage with local initiatives providing affordable healthcare, such as community clinics or volunteer caregiver programs. These can be lifelines in areas most affected by these potential cuts. And in terms of long-care planning, encourage personal planning for long-term care needs. Exploring alternatives like long-term care insurance might help individuals prepare for future financial burdens. The potential end of Medicaid services is a serious threat to the well-being of our senior population. As a marketing agency focused on senior living, we see firsthand the devastating effects this could have, not just on healthcare, but on the overall quality of life for older adults. So we're urging everyone to get involved, stay informed, and advocate for policies that protect our seniors. Join us in this movement, share this message, talk about it in your networks, and help us ensure that the needs of older adults are not ignored. What will you do to support our seniors? Drop a comment below. I'm eager to hear how you plan to make a difference. Thanks, everyone.